Could a change in how we test for STIs help bring down the high rates of infections in Australia? The number of syphilis cases has tripled over the past decade. There was a drop during COVID-19, but otherwise you can see it's been steadily rising. Rates of gonorrhea have also been increasing. Chlamydia remains the most common STI, with about 94,000 confirmed cases a year. A study from the Melbourne Sexual Health Centre found getting people a rapid test result could help slow the spread.
I'm pretty sure she's got chlamydia.
It usually takes 5 to 7 days to get answers back from a lab. The common practice is for a doctor to prescribe an antibiotic based on the symptoms, rather than wait for the test result.
You can imagine that is going to result in a lot of antibiotic overuse or overtreatment, as well as misuse, the wrong antibiotic. And so the proportion of patients that actually receive the right treatment can be relatively small.
So during the study we had access to a rapid test. They provided the result within a couple of hours. So often that patient was asked to either wait around, go have lunch, pop across the road to the park, and we would contact them for their result, or they could opt to, and we usually did that via SMS.
It meant if the patient did have an STI, doctors could prescribe the correct antibiotic and people could notify their sexual partners immediately.
There are other specific STIs that are developing resistance, as I mentioned before, and knowing the actual antibiotic that will treat that infection, which may be different depending on the resistance profile of that organism, is even more important in combating rising STIs.
But converting to rapid testing in big, well-established clinics could be difficult and expensive. There are a few factors that are likely contributing to the high rates of STIs. The pandemic interrupted testing and healthcare. Rates are higher in Aboriginal communities and remote locations, again pointing to a lack of access to testing and treatment. And effective HIV prevention medication may be leading to a reduction in condom use, particularly among gay and bisexual men. The federal government is rolling out a new campaign on social media and dating apps that it's calling Before Play. It's hoping to encourage more people to get tested and to use a condom or dental dam.